Thank you, everyone. So I'm Jhalok Talukdar. I'm a PhD candidate at HRM program. I'm working under the supervision of Dr. Lawrence Bogbo and then Dr. Russell D. Souza. So I'm going to present our systematic review and meta-analysis of randomized controlled trials. So this trial actually assesses the effect of inulin-type supplementation on cardiovascular disease risk factors. So this is the outline of my presentation. I'll talk a bit about the background of our review, methods we use, the findings and limitation of our review, and finally I will conclude. So inulin-type fructans are plant-based carbohydrate. Among the sources of inulin-type fructans include leek, onion, artichoke, banana, garlic, chicory. So inulin-type fructose is actually digestion in the upper gastrointestinal tract and are fermented in the colon. So their consumption may improve cardiovascular risk factor. So we try to understand the effect of inulin-type fructose supplementation on low-density lipoprotein, triglycerides, fasting blood glucose in adults. So we searched 6 databases and we supplemented the database search with hand search of a reference list of included studies. We considered studies which included adults with or without cardiovascular risk factors. And intervention included like inulin-type fructose supplementation, which compared placebo or no supplementation. And our primary outcome was low density lipoprotein, triglyceride, and fasting blood glucose. So for risk of bias assessment, we use Concurrent risk of bias assessment tool version 2. And for certainty of evidence assessment, we use GRADE. We use random effect model for data synthesis. For subgroup analysis was based on sex, baseline comorbidity, inulin-type fructose type, inulin-type fructose dose, risk of bias, duration of intervention. We did 5 sensitivity analysis, which include leave one out sensitivity analysis and analysis excluding high risk of bias trial, excluding crossover trials, parallel analysis of crossover trials, and including only food control trials. So from our database search and reference searches, we identify 1,466 records, and from them we identify 51 trials to include in our meta-analysis. Sorry. So if you look at the summary risk of bias, then you will notice that there are around 40% trials with high risk of bias. So bias due to missing outcome data was most common among the included trials. For low density lipoprotein outcome, we included 37 RCTs with more than 1,800 participants in our meta-analysis. So if you look at the meta-analysis result, you'll notice that inulin-type fructose supplementation reduced low density lipoprotein by 0.02 millimole per liter. However, the certainty of evidence for this outcome was very low. For triglyceride outcome, so we included 39 RCTs with around like 1,700 participants. So for this one, we also found that like inulin-type fructose supplementation reduced triglyceride by 0.06 millimole per liter, and the certainty of evidence was low for this outcome. And for fasting blood glucose, we included 34 RCTs with more than 1,400 participants. For this outcome, there was little to no effect of inulin-type fructose supplementation on fasting blood glucose, and the certainty evidence was very low for this outcome as well. So in subgroup analysis, we found beneficial effect of inulin-type fructose supplementation in female and comorbid participant, and when the dose was at least 10 grams and supplemented for at least 6 weeks for low density lipoprotein and triglyceride outcomes, but no subgroup differences for fasting blood glucose. In sensitivity analysis, we did not notice any substantial change in effect estimate when we did leave one out sensitivity analysis. We did analysis excluding high risk of bias trials, excluding crossover trials, or like parallel analysis of crossover trials, or including only food control trials. So our study has a few limitations. So one of the limitations of our review is that there was considerable heterogeneity between the study, but this heterogeneity were explained in our subgroup analysis. Another limitation of our review was that we incorporated data from both parallel group analysis and crossover parallel group trials and crossover trials using an naive analysis. But to address this limitation, we did sensitivity analysis following published guidance, which should work as an example for future research, we think. So in conclusion, we can say that inulin-type fructose possibly reduce low density lipoprotein and triglycerides. Inulin-type fructose might be particularly beneficial if supplemented with a dose of at least 10 grams for minimum of 6 weeks. And it is beneficial, especially for the female participant and patients with comorbidities, for example, type 2 diabetes. But the certainty of evidence of inulin-type fructose supplementation is was low to very low. So we think we will design and execute trials are necessary to better understand the role of inulin-type fructose supplementation in a healthy diet. So this is our studies team. I thank all of the team members for contributing in different parts of this review. These are the links I use for the emails for this presentation. So thank you, and happy to answer any question you might have.